So modern Western history equates thinness and health and beauty. In fact, in the United States, thinness has become a national obsession. Most of us are preoccupied with how much we eat, as well as the taste and nutritional value of our food. Thus, it's not very surprising that in the past 3 decades, we've witnessed an increase in the 3 eating disorders, which will be the focus of this chapter: anorexia, bulimia, and binge eating disorder. So welcome back to Abnormal Psychology, and this week we're going to cover Chapter 11, Eating Disorders. Have the learning objectives posted here. They are also in your textbook. So the symptoms of anorexia may be difficult to identify. Sufferers will go to great lengths to hide their conditions, and the primary reason they go to great lengths to hide their condition is they do not want to be found out because they do not want to be forced to eat food. And that has to do with their fear of being forced to eat food, which would cause them to gain weight. Symptoms of anorexia include eating very little, missing meals altogether, being extremely thin, having a distorted body image, denial of low weight. So if you say, oh, you're looking skinny, they'll say, no, no, no. Becoming obsessed with caloric intake or nutritional content of food, using appetite suppressants or laxatives to lose weight, using scales obsessively, constantly checking their body shape in the mirror, using the table quickly after a meal to vomit, which, by the way, this brings up a really good point. People with anorexia can purge the same as people with bulimia. And I think there's a common misconception that people with anorexia starve and people with bulimia purge. And that is not the diagnostic difference between the two. People with anorexia may purge or they may not. It depends on, there's different types of anorexia. So if somebody is purging, you cannot discern whether or not they have bulimia or anorexia. You need more information. And what the diagnostic difference has to do with how much they weigh. If they are significantly underweight, then we look at anorexia. If they are average or slightly above average weight, then we look at bulimia. But just because they are purging does not mean that they have bulimia or does not mean that they have anorexia. So let's take a look real quick. There are 3 main things that we look at in the DSM for the diagnosis of anorexia. The first thing is, by definition, the person has to have low weight. They have to be significantly underweight. If they are not significantly underweight, then we do not give the diagnosis of anorexia. The second thing is they have to have an intense fear of gaining weight or becoming fat, and the fear does not improve. As a matter of fact, as the person loses weight, that fear generally increases. And then the third thing is they have a distorted view of their body, weight, and shape. And they feel overweight, and it could be all over, that they feel that they're fat or that their body, that they're fat, or it could be a specific part of their body. Individuals diagnosed with bulimia undertake frequent binge eating, followed by expelling the food. And this is typically done with vomiting, but it could also be done through extreme exercising. It could be done with laxative agents such as diuretics or enemas. The binge eating occurs, and then it is prompted by with a negative perception of one's body. So the person eats a lot, and then they have this extreme negative perception of their body, and they feel compelled to binge. And after they binge, there is some sort of relief that is temporarily felt. And for a period of time, then they feel slightly better, and then the cycle continues. The individual with bulimia tends to be over anxious with their body weight, and they see purging the food as necessary. This is in contrast to the disorder binge eating disorder, which your book does talk about. I'm not going to talk about in this preview here, but your book does talk about it, and you are responsible for that disorder as well. And binge eating disorder does not involve purging the disorder after excessive food consumption. Bulimia and anorexia are very similar in some respects. The two are by no means identical, and I do want to point out that there is a lot of variety with the disorders. So as I'm giving you the overall, I don't want you to think that every single person is the same, because obviously, in fact, in all the disorders, there is a wide spectrum. But again, keep in mind that patients with anorexia are significantly underweight. Bulimia patients could be underweight, but they do not meet the criteria for being underweight. So what we're looking at is what we consider a normal body weight for that age and height, or they could be slightly overweight. So here are the diagnostic criteria for the DSM. So the first thing we have is we have a recurrent episode of binge eating. And this happens during a discrete period of time. So there's some period of time that the person is eating larger amounts than most people would eat. And during this time, they generally have what we call a lack of sense of, or lack of control over what they're eating. They then have inappropriate behavior to prevent weight gain. So they induce vomiting, they misuse laxatives, diuretics, other medications. There's all kinds of teas that you can get out there that will cause you to have diarrhea. There could be excessive exercising. So some sort of behavior that compensates for the binge. There is a time limit that is required. So for bulimia, this needs to happen at least once a week. So we're not talking about somebody who ate way too much, they came home, and then they made themselves throw up once. We're talking about this needs to happen at least once a week, and it needs to be consistently once a week for 3 months. And on top of that, the person also needs to have a preoccupation that has to do with their body shape and weight. So these are the diagnostic criteria for bulimia. Here I have the diagnostic criteria side by side, and you can take a look at how they are similar, but there are some differences. And again, I just want to point out anorexia has a significantly low weight versus bulimia does not have that as a diagnostic criteria. We also have with anorexia, remember I said that there were 2 types. There is the restricting type, which is I think what we would consider stereotypical. That would be the starving. And then here the binge eating purging type. So we do have a type of anorexia where there is the person who might eat but then make themselves throw up or purge. And I think that's where some of the confusion comes in, because if somebody hears somebody, they say, oh, they threw up, they must be bulimic. Well, that is not necessarily the case. So keep in mind, we're taking a look at weight. Here with bulimia, we have, again, just as I talked about, the eating in a discrete period of time. We have the sense of lack of control while they're doing it. And then we have them using some sort of measures to mediate what they just ate. So the vomiting or the misuse of laxatives. And they're doing it on average once a week for at least 3 months. And with both disorders, we have the person focusing on body shape and weight. And we have different qualifiers here, just talking about how often the person is doing it. And I would not quiz you on these. This is just more for your interest, just to take a look at these. But I would not quiz you as to whether or not a case was mild, moderate, severe, extreme, just more for your interest. However, if you're considering going to graduate school, this would be something that you would need to know. I know some of you are considering going on, so I'll just point that out. So what is due this week? Well, I have the learning objectives posted. There is an outline, and you can print that out and use it to help you as you read through the chapter. Then there is a Khan Academy video. I'm not quizzing you on it, but I really do hope you watch it. I think it is very helpful, and it does differentiate between the two disorders. Then there is the bulimia causes, symptoms, and treatment. There is a video lecture quiz on this, and there is a video lecture quiz on anorexia causes, symptoms, and treatment. And then I have another video. It is the neuroscience of eating disorders, and I do not have, here, I'll put a thing here. There is not a quiz on this one, and there is not a quiz on this one. This neuroscience of eating disorders, I posted it because I think it is so important that we understand that it is not a matter of saying, just eat more. There are neurological differences and things that happen in the brain, and this video is about 5 minutes. And I thought it was not only interesting, but it kind of just explains things in a very simplistic way to show us what actually happens in the brain with eating disorders. So I did post that, and I hope that you do take the time just to watch it. But then there are 3 quizzes this week. So we have the video lecture quiz on anorexia, video lecture quiz on bulimia, and then the chapter quiz, which you get 2 attempts on. If you have any questions, please let me know. I hope that you have a great a great week. And please keep in mind that even though Sunday is a holiday for a lot of people, we do have things due on Sunday. So finish up early if you would like to have your Sunday off. So enjoy your week, and I hope that we are done with the snow this week. Let me know if you have any questions. Take care.